The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi everyone. Today on Aging Horizons, we've got with us one of our favorite guests, Carl Roston. He's the State Suicide Prevention Coordinator for DPHHS, and we always enjoy having Carl because he always brings lots of great information, but most of all, lots of great hope. We want you to know all about this. Stay with us. We'll see you soon.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimi Everman, and as I said in the open, we've got one of our favorite guests with us today, Carl Roston, and he's the State Suicide Prevention Coordinator. Welcome,
Thank
Carl.
you very much.
It's always good to have you here, and I know that sounds weird considering what you do. However, you really do bring a lot of hope and a lot of great information and resources every time you come, and we really appreciate that, or I really do.
Thank you.
Let's just start off today by talking about, we don't get too into the weeds, but statistically, as we roll along, how are we doing here in Montana with our suicide rate?
Well, it's still very, very high. I mean, we've been, and this is nothing new, we've been in the top 5 for the last 40 years.
Sure.
Matter of fact, even if we go back to 1918 when the Office of Vital Statistics was created, Montana's been a top-tier state for suicide for more than 100 years.
But you're also combating it with so many things. Maybe we could talk just a little bit about just some of the things that you're involved with, Carl, that really are bringing hope to the table.
Sure. So a lot of it is around raising awareness. Montana, one of the major issues the Rocky Mountain region and Montana in particular have such a high suicide rate has to do with stigma. We have that cowboy mentality. We don't like to talk about our problems. And we think it's a weakness, or we think we're a burden. And if you think you're a burden, you're not going to ask for help. And so we're really trying to challenge that stigma, and by raising awareness around the issue, that this is an issue that is preventable and that we need to start to talk about it. And it also means that we have to start taking a look at places where people can get that help. And of course, we always talk about behavioral health, but we're never going to have enough behavioral health in our state.
Right.
But we do have primary care. And so there's really been a big push in the last couple of years to increase the training and the awareness in our primary primary care providers, our nurses, and our doctors.
You know, and I think, if I remember right, I think the last time I saw my doc just a month ago, it was for my yearly, and they asked me some questions about was I depressed or suicidal, and I was impressed that was on that form.
Yep, and that's the national recommendation. The national recommendations are now calling for universal screening for depression and anxiety starting at age 12. And so it should be something that is done every time you go to the doctor. Just it's basically like the next vital sign. You know, they take your weight, your blood pressure. They also should be checking around your depression or anxiety.
Well, yeah, and I know that we've had a lot in our country over the last few years that's been difficult and traumatizing for a lot of folks, and so speaking about it can really help. And when you check in with your doctor.
Absolutely, and once it's out there, it's something that is something that we can understand and we can treat. That's the big thing. It's one of the depression is one of the most treatable, but we have to start talking about it. And what we know from the stats is 69% of people that are depressed, when they go see their doctor, they only talk about the physical symptoms.
Sure.
They don't talk about the emotional, and so we have to ask the question if we want to get the answer.
Exactly. Now, you mentioned Montana being such a high rate. One of the components there is gun.
Absolutely.
Gun accessibility, correct?
Right, absolutely, and that's an issue of access. By far, the most common means of attempt is overdose. About 70 to 90% of all suicide attempts are by overdose. However, it's the least lethal. Only about 3 to 11% result in death. Whereas somebody uses a firearm, it's 93%. Well, Montana is number 2 in the nation in gun ownership at about 63.5%, second only to Wyoming at about 65%. So it's an issue of access. If you don't have access to the lethal means, your chance of survival goes up greatly.
Right. And I think, you put that into the basket with the stigma part, and we have a state that's just really ripe for that.
Right, and it's important. It is a regional thing. I mean, if you take a look at the top 10 states for suicide, 8 of the 10 are Rocky Mountain region states.
Well, and also the light issue.
Absolutely. There's a lot of different issues, definitely. But in the Rocky Mountain region, we have a perfect storm as far as all these factors happening at the same time.
Yes. Well, and one of the things that I want to talk about is, because I want to talk about this several times, the 988. Why don't you talk about that for a second?
Definitely.
Carl?
And we've had a crisis, the National Crisis Suicide Prevention Line, for decades, the 800-273 TALK. Well, in order to make it easier, in July, nationally, the number got changed to 988 to make it more accessible. And right now, Montana has one of the highest performing call centers in the nation. 98%, we've had a 30% increase in call capacity in the last 4 or 5 months. We've had about 98% of the calls stay in state. We've cut down the response time from 32 seconds down to 13 seconds. And what's most important, about 72% of the time the issue is resolved on the phone. Emergency interaction isn't necessary.
Done.
So we really want people not only to know that number as a resource, but as an intervention as well.
Sure. So why do you think that last 3 or 4 months statistic caught me off guard a little, that it's gone up? So why do you think?
Well, they anticipated that. They actually, nationally, they anticipated a 30% increase because it's an easier number to remember. It's 988 compared to the 800-273, 8255. It's a lot easier. And so people can remember that, and we're promoting it with everything that we do.
Great. Well, you have a lot more that you're involved with in this great area, and we're going to talk about that when we come back, Carl.
Okay.
And folks, let's just talk about it for a second. That stigma thing. We don't have to be a prisoner to that. We can speak up. We can speak our feelings. No one's going to judge us. No one's going to think that we're bad because we have feelings that maybe they don't have. It's a really important place to start. Start knowing that it's okay to talk about who you are, what you want, and how you feel. And when we get back, we'll talk about more things going on in Montana. So stay tuned.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
Hi folks, welcome back to Aging Horizons. I'm Kimmy Everman and we're here with Carl Roston, the State Suicide Prevention Coordinator. Carl,
thank you.
Always good to have you. So let's talk a little bit about, it might be that because we hesitate to talk about suicide or suicidal, ideation or suicidal, behaviors we see in our friends, we might not recognize it.
Right.
What are the signs we should be looking for?
Well, and first of all, just to kind of go with what you just said, there's a myth out there that people think if they bring it up, they could put the idea in the person's head. There's not 1 ounce of research to support that. Yeah. Not one. Yeah. On the contrary, asking somebody if they're suicidal or if having thoughts of killing themselves validates their pain. It gives them opportunity to talk. It gives them hope. Mm-hmm. It lowers impulsivity. You can do no harm. Mm-hmm. But when we talk about the warning signs, this is a person that may start to make statements around mortality, like no one would miss me, everybody would be better off if I wasn't here. There's often a change in their substance use. They often increase, either they start to use or they use more and more. They start to be more irritable. There's a depressed mood. They start to withdraw. They start to pull away from family. They start to pull away from, or they stop hanging out with friends. And they stop doing the things that they usually love. I mean, the things that they enjoy, they stop doing. Mm-hmm. There's often a sense of hopelessness, and there's often a change in their sleep patterns, and it can go either way. Too much, too little, but we start looking for those changes in sleep patterns. They start to give away possessions. There's often a deterioration in hygiene. If you see these warning signs, this is the time when you have to be able to say, hey, I'm worried about you. Are you suicidal, or how are you having thoughts of killing yourself? You can do no harm by doing that.
Yeah. And I love that you said it validates that person and how they're feeling, because I think when you're in that position, it's so easy to think you're the only person in the world.
Yes.
And you're all alone and feel so isolated.
And that's part of the cognitive distortion that happens with depression, is it changes our perception of the world. We see the world as a dark, lonely place, and we think no one cares about us. And so that's when you start to see all these symptoms come out.
So what if you're a person who has a friend that may be having some issues and they have weapons and things?
Yeah.
How do you deal with that?
We really emphasize safe storage, for temporarily secure, not just firearms, medications as well, but making sure that their home is safe, whether there's gun locks, give them to a friend for a family member for a couple days. At the very least, lock up the gun in one location, lock up the ammunition separately.
Yeah.
Lock up medications. All these things, if time is our greatest ally. The more we have time, the less likely there's an attempt. They've even done some studies that came out of England where if you gave somebody a bottle of pills and gave them exactly the same medication in a blister pack, the suicide rate drops with the blister pack because of the time it takes to punch out the pills. So time is a critical component to prevention.
That's a great, I'm so glad you brought that up, because I think about it, and also maybe even I can't take more than this. It's in this official blister pack.
Right.
So, what a great idea. So another thing that we can do if we have somebody that we're concerned about is reach out, you have a website that there's a lot of resources on.
We have a ton of resources we're constantly adding. We actually have created an interactive toolkit where people can go in, and depending on the population, whether it's kids, whether it's veterans, whether it's Native Americans, the elderly, schools, hospitals, there's sections on there where they can immediately get linked to national resources and tools that are there. We have we have a great video for parents because one of the things we know is 86% of parents that lose a child to suicide didn't even know their kid was depressed. Because as parents we lose our objectivity. And so this, by the way, another reason.
As a teenager, I could hide it well too.
And another great reason, by the way, to get your kids screened. But there's a great video. It's done by the Mayo Clinic. It's 4.5 minutes long.
You can do that.
It's done by kids, and it helps parents recognize the signs.
And we're going to run. I think we already have run your website address there across the screen, because we really want people to know how to get those resources. And in our last couple of minutes, I wanted to ask you about the hotline. What if I'm the person with a friend and I don't know how to talk to them?
Absolutely.
Do I call the hotline?
Yes, absolutely. It's not just for the people that are in crisis. It's for someone you're worried about. We get calls. We get calls nationally. Somebody will call 988, and of course it goes to their local one, but then it gets and if they're saying, we had a call from Tennessee that they were worried about their sister in Billings. And so they called 988, they transferred to the Montana, and then they were able to connect and give that person resources and help them get the resources.
Because in all these call centers, people are working as a team
They're
to
all
make
linked.
this work.
Right.
To make it work so that it's the easiest on who's ever the caller, right? And that they can get the quickest assistance and the best assistance. And so it's 988, and you just...
Yeah, and you can text or call.
Okay.
And there's chat.
So you can text.
Yes.
Yeah. Okay.
Yes.
And like I was saying before we got on camera, I like to text things sometimes too, and I think it would be a really less awkward, comfortable way for some people. To get that message across.
Yes, definitely.
Well, that's great. And folks, we're going to talk some more about resources when we come back, so that you know where to go to find the information you need for yourself, for a friend, for a relative. It doesn't matter. We want to make sure that you understand it's out there for you, and there is no stigma about it. And you can also talk to someone at 988 if you're worried that you don't have the right words. Come on back. We have a lot more to talk about.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
A decade of Montana fourth graders on Energy Share. Robbie Holman reminds us that even during the chilliest Montana winters, our homes don't have to be cold, not if we Energy Share the love. And Emma Bergman knows who to call when the cost of heating your home starts to put a chill on your family. Emma says, when winter is in the air, it's time to care with Energy Share. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies the Montana way. Call or visit our website today. Thanks, Energy Share, for helping people in need.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Hi, everyone, and welcome back to Aging Horizons. I'm Kimmy Everman, and we're here with Carl Roston today. Carl, always good to have you.
Thank you.
Let's talk a little bit about, you've got programs for schools and another really sort of big one that I really want to hear about that you've got going on right now. Tell us a little bit about what you're doing right now.
Sure, and it's important when we talk about suicide prevention that you can't just do one intervention.
Right.
It's across the lifespan. It really is. And we have programs that they're starting as young as elementary school. There's a great program called the PACS Good Behavior Game that teaches kids coping skills and resiliency skills that has been shown to last 30 years later. And it's not just suicide, it's mental health, it's substance abuse, criminal behavior. So teaching kids, giving the kids skills at an early age is critical. We're starting to do assessments in schools. There's a great organization called the Rural Behavioral Health Institute, and they are screening kids in schools. It's a computerized screening to help identify kids right away that have depression, anxiety, substance abuse, suicide. We have programs in schools for middle and high schools. The SOS program is a program that teaches kids about the warning signs and how to intervene. We have community-based trainings for people to raise awareness. One's called QPR. We also have a great mental health one called Mental Health First Aid that teaches the basics of mental health. But probably the biggest thing that we're pushing right now is what's called Zero Suicide, or the Suicide Safe Care. And that is to train nurses and doctors on how to do depression screens, suicide risk assessments, safety plans, lethal means counseling, and caring contact. And we're currently training in just about all the schools of nursing in the state, the PA program at Rocky Mountain, the psychologists and social workers at U of M, counselors, pharmacists. We're training pharmacists, and we're also training at hospitals around the state. Because we will never have enough behavioral health, but we do have doctors and we have nurses, and they are the first point of contact for many of these people. And if they know the questions to ask and what to look for, we have a high likelihood of reducing the risk of suicide.
Right, and I think, gosh, to have someone actually, as you said earlier, validate what your feelings are, and to say, I'm your first point of contact and I will find you some assistance, or I will find you the resources that you're asking me for. It's so important to, maybe that person thought there was no one.
Right.
And there they are. I just think that's awesome. And then you also have it's a bit far away, but people like to get it on their calendar. There's a conference on suicide prevention in July 28th.
Yes, in Billings. And it's our state, every year we have a state suicide prevention conference, and this year our theme is around maternal health. We're going to be bringing in some national people to do train the trainer, which we've been doing for the last year, but we're going to focus one of the sessions on that, so that we have more people that can go out and do trainings in healthcare settings around the state. We have about 60 people right now, trainers. We'd like to get up to 80 to 100, so that every part of the state is covered. There's trainings available for healthcare providers around the state.
And if you wouldn't mind, Carl, just very briefly, what does that look like, maternal health zero suicide training? I'm not quite sure I understand.
Well, we know that there's a high risk of postpartum depression. Okay, with women, that hormones are often all messed up after having a birth. Right, and so getting as part of the standard care after with a mother is to do an assessment, make sure that not only physically but emotionally that they're also doing well. And so the zero suicide is there's a screen called the PHQ-9, which is a depression screen, and then there's a suicide risk assessment called the Columbia Suicide Severity Rating Scale. This is a quick, easy way to assess level of risk in somebody. And then we have safety plans, and a safety plan is basically a list of tools that the person can use if they're feeling at risk or they're feeling in danger. People they can contact, crisis resources. It's all on a nice one-page plan type of thing. There's even an app on the phone that you can use. But it's a way for people to have. I mentioned that cognitive distortion earlier about people have a kind of a cloud, and many times they won't remember what they can do. Our problem solving abilities diminish during a crisis, and we won't remember our spouse's phone number, our parents' phone number. So a safety plan outlines all that stuff. It's something that's there, right there, so that they always have access to it.
Well, and, I think of so many of my friends who had children who were sleep deprived. That was huge for so many of them, and they couldn't remember phone numbers and what time it was and stuff, because you can't go forever without sleeping.
Right,
like that.
Absolutely.
So, well, thank you, Carl, because that just makes me happy to know that that's coming up. It's really lovely to know that we have a state that's interested in, and staff in the state making niche kinds of calls, because that's not the broadest thing in the world, but it is definitely necessary. And you're right, the postpartum depression can be deadly.
Yes, absolutely.
As we well know.
Yes.
Well, we just got about a minute left, Carl. What should we be taking from the show today, besides stigma?
Right. Well, I think the mental health side of it is critical. If we just focus on suicide prevention, we're going to miss the boat. Suicide is the end result of usually undiagnosed, untreated mental health issues. And I think we need to be more open about that. And we need to realize that depression, anxiety are biologically based conditions. They are medical issues.
Absolutely.
And we need to start treating them as such. And that needs to be a routine part of assessment. It's also one of the most treatable. And so it's something that I really want to encourage people not only to learn the signs, but talk to your primary care provider, because there are resources available. You don't have to suffer.
Thank you so much, Carl, for being with us. That's great advice. And folks, I'm with him. My doc is asking me those things. So when you go next time, see if that's part of the sort of discussion, and if you have something to say, reach out. You won't be judged. For Aging Horizons, I'm Kimmy Everman. Thanks for being with us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.